Good morning. I understand that you've come in, you've got some dental questions, you've got some teeth that aren't quite in the right place, a little bit crowded, you've got some decay. It's been a while since you were in to see a dentist, and that you've just been sort of put off because your last experience was a little bit harsh. You don't know why it was harsh, it was painful, and you just sort of avoided having anything done. And now you've had an emergency where you've had to have a tooth taken out, and there's some other decay that you're aware of. And in all of that, you've wondered about your bite, and there's just so many questions on your mind that you're just sort of confused, and that's why you're here today. Well, I've had a look at your mouth, and I've seen that there's a slight amount of crowding. It's not bad. I've seen that there's a fair amount of decay, so that needs to be addressed as well. And what we're doing here is we're going to talk about how to give you the teeth that you want, but more importantly, we're going to talk about what makes teeth right. The concept of form following function is really what we should talk about, because pure aesthetics in a system as complex as the mouth, where there are joints, muscles, ligaments, bone, gum, teeth, nerve that drives all of this stuff. It's important that we get the mechanics right as well as we get the teeth fixed, okay? And that's not a totally easy concept, because people think, well, if I want straight teeth, I'm going to have braces. If I'm going to have root canals, I've got to have root canals and crowns by some. But the idea of a reconstruction of my mouth is not something that most people think about, all right? So the first thing that I'm going to share with you as we go through this is the mechanics of your mouth, okay? And the way that I do this is to make a metaphor, and the metaphor is a car. There's three major points that we experience when we are driving a car, okay? And those apply to the mouth, believe it or not. All right, so the first thing that we're going to talk about is the steering mechanism. When you get into a car, yes, you start it up, but without the steering wheel, you're going nowhere, right? And the steering wheel guides all of the movements of the car, wherever you go. Whether you're going forward or backwards, you've got to have that steering wheel. And so it is with the mouth, the human mouth. There must be a steering mechanism. And the steering mechanism in the human mouth are the 6 front upper teeth overlapping the 6 lower front teeth in a way that allows them, just like a steering wheel, to guide every chewing movement, every speaking movement that we make. I'm going to show you this in a case study here. Here's a before shot. Can you see that? This woman, who is in her 60s, had hated the way her teeth looked all her life. And she wanted straight teeth. And because she'd been a patient for a lot of years, I knew that she didn't have very good function. Even though she had lots of crowns on her teeth and everything else, she didn't have good function because her teeth weren't working so that there was a steering mechanism in place. So this is what the steering mechanism is. I actually mocked up her teeth to look. Now let's do this first. Let's do it this way first so you can see. I mocked up her teeth so that they're straight. Can you see the difference between what she looked like there and what she looks like now? So then I put this on a bite simulator, and this is what steering means. It's those 6 front teeth there on the top over the 6 front teeth on the bottom. And the leading edges of these teeth here touching halfway up the backs of those front teeth there, so that when this person chews their food in the way that we chew our food, all of the guidance happens on these front teeth. It incisors and it gives the tolerances or the space between the back teeth to crush and grind the food. But the back teeth never do this. They never mortar and pestle themselves. Okay? They're never rubbing against themselves. It's the front teeth that control this. Because we don't need the teeth to mortar and pestle. We just need a gap in there where the food can get chewed up. Okay? So, the steering mechanism is very, very important, because when the back teeth mortar and pestle and they scrub against each other, they send a message to the brain that says, grind harder. Grind that piece of interference, grind it off. And so then we grind more and harder and ultimately wear down teeth. Some people this isn't really noticeable, but in other people it's terribly noticeable. And it can result in lost teeth, cracked teeth, teeth that get loose, teeth that move. It can be a real problem. So the steering mechanism in the mouth, these front teeth, are very, very important. Secondly, there must be balance. There must be great balance in the mouth, similar to a car. When you're driving down the road in a car and you hit highway speeds and your steering wheel starts to shake on you, you know that your wheels are out of balance. Women know this, men know this. This is something that's universally known. Don't have to teach anybody. We just know this kind of stuff, right? Well, in the mouth, the balance is this, that we have peaks and valleys on our back teeth. And the upper peaks fit into the lower valleys. And if the steering mechanism isn't in place, or if the teeth fit in a funny way so that the peaks hit each other, that message goes to the brain and it says, grind off the peaks. So it's very important that we make sure that those peaks and valleys are in a natural rhythm so that the upper peak fits into the valley, but then as we grind our food, it leaves a gap between the peaks where the food gets crushed and tumbled and broken up. That's what that's all about, okay? So balance is a very important thing so that we don't incite unusual grinding, okay? Now remember, we're talking about the mechanics of the mouth. If we get these things right, form will follow function. You'll have beautiful teeth. They'll be straight because they have to be straight in order to do what we're talking about. The third and the last thing that I'm going to mention today is alignment. And this is very important. In a car, when you're traveling down the road, and the car pulls to the left or it pulls to the right, you know that you have an alignment problem, all right? Well, in the mouth, the alignment is similar in the sense that if it's not right, we're off to the left or the right. The ball and socket assembly, the temporomandibular joint, as it is called, is the most complex joint in the whole body. It not only rotates, but it moves, and it moves side to side, front and back, and it has some very special mechanics. It is principally governed, its position, that is, fitting ball into the socket, is principally governed by muscles and ligaments. However, the lower part of the whole system is movable. This jawbone here is like a hockey stick. Here's the shaft, here's the blade. And then it's fused in the middle, so it's like a double hockey stick. You got a left winger and a right winger, okay? And so when these teeth come together, this lower jaw, which has teeth on it, come together, it may cause the ball and socket assembly to move out of its orthopedically correct position. It may move back, or it may move forward when the teeth mesh, all right? So when the teeth mesh, they cause the ball to move out of its orthopedically correct position. It causes the muscles to tense. They've got to be on guard. So some people have muscles that are constantly like this. And it pulls on the ligaments. It causes lactic acid to build up into the muscles of mastication. It can be responsible for headaches. It can be responsible for pain in the muscles of mastication, these big muscles on the side of our face. It can cause clicking and popping of joints, which is the ligament that's been stretched inside of there, because they're constantly pulling, because they're out of alignment. All right. So, when we work with you, what we'll do first is we'll reconstruct your upper teeth and your lower teeth, the front teeth, okay? Just like we did with this person here, I will actually take your molds which have been taken today, and we will mock that up so that it has those principles based in it. Now, interestingly enough, sometimes the bite has to be taken over completely. This woman had lots of crowns in her mouth, but when we put these teeth together and put them in the right angle and the right length, we found that the teeth were actually apart. See that? Okay. So what we did is we placed these platforms, we call them stops in dentistry, so that when she comes together, all 28 teeth of her hit at the same time, and the ball and the socket fit exactly in its orthopedically correct position. Now, this woman has these teeth now in place, and she actually has these stops in place, and now we don't have balancing problems, we don't have alignment problems, and we have beautiful steering going on in her mouth, so that her joints are happy for the first time in her life. I mean, this is a woman in her mid-60s. Okay? So it's important for us and you to understand that when we do this, we may deal with your situation one step at a time, so that everything is stable as we go. You'll feel more comfortable, you'll chew your food better, you'll have fewer aches and pains, things that you will come back and say to me, you know what, I've had this nagging headache or whatever, I couldn't figure it out. In the morning I'd wake up and it would be just something I'd have to get over, and sometimes I even had to take some medication for it. That'll disappear. Because when these elements are right, the whole body relaxes. When these elements are right, you have beautiful appearance. When these elements are right, there is no need for retainers. These teeth are stable, stable, stable. They're going to stay that way for the rest of your life. So reconstruction is a very special part of dentistry that is important for people like yourself, and we'll be happy to get started as soon as you're ready. Do you have any questions? Did that answer some of the questions that you had? Wonderful. All right. We'll see you later.